Hi friends, good evening and welcome back to my channel Mokambika Nursing. Friends, here we are preparing questions for ESIC, RRB, DSSSB exam, DME exam, also Insurance Medical Service exam, JPHN exam. Surely these questions will helpful for your studies. We can see the questions. First question, Parkinson's disease is characterized by deficiency of which of the following neurotransmitter? Options, option A acetylcholine, option B serotonin, option C dopamine, option C epinephrine. Question, which neurotransmitter deficiency occurs in Parkinson's disease? And the correct answer is option C, it is dopamine. Parkinson's disease is a chronic progressive neurologic disorder that results from the loss of neurotransmitter dopamine. Usually, the degenerative changes occurs in the area of the brain, that is substantia nigra, which produces dopamine. Dopamine is a chemical substance that has the power to control the body, that is the people can able to move normally and smoothly. Okay, so dopamine which helpful for the movements. Next question we can see, which symptoms occurs initially in Parkinson's disease? Options, option A akinesia, option B aspiration of food, option C dementia, option D pill rolling movement of hands. Question, which is the initial symptoms in Parkinson's disease? 6 cardinal features occurs in Parkinson's disease. They are tremors at rest, that is especially pill rolling movements, and also rigidity, bradykinesia. Bradykinesia means slow movement, and also fixed posture of neck, trunk and limbs. Fifth one, loss of postural reflexes and freezing movement. Okay, here our question, which symptom initially occurs in Parkinson's disease is pill rolling movement. Option D is the correct answer. Move on to the next question. Sciatic nerve arises from which of the nerve plexus? Options, option A brachial plexus, option B choroid plexus, option C lumbosacral plexus, option D cervical plexus. Sciatic nerve arises from lumbosacral plexus. Option C is the correct answer. Sciatic nerve is the longest nerve in the body. Sciatic nerve. The next question is sciatic nerve is also known as options. Option A brachial nerve, option B cervical nerve, option C sciatic nerve, option D sacral nerve. Sciatic nerve is also known as sciatic nerve. Option C is the correct answer. Move on to the next question. Waiter's tip position is seen in options. Option A Erb's palsy, option B Bell's palsy, option C facial palsy, option D all of this. Waiter's tip position is seen in Erb's palsy. Option A is the correct answer. Erb's point, another one important question. Erb's point is formed by the union of C5, C6 nerve root. Okay, this is also important. Erb's point means between C5 and C6. And the next question, cauliflower-like warts are seen in which infection? Options, option A AIDS, option B human papillomavirus, option C gonorrhea, option D syphilis. Cauliflower-like warts are seen in human papillomavirus infection. Option B is the correct answer. Human papillomavirus cause genital and anal warts. Okay, the causative organism of genital warts is human papillomavirus. And the next question, postpartum pituitary gland necrosis is also known as options. Option A HELLP syndrome, option B Sheehan syndrome, option C compartment syndrome, and option D none of this. Postpartum pituitary gland necrosis is also known as Sheehan syndrome. Option B is the correct answer. This occurs due to postpartum hypopituitarism. Move on to the next question. The organ which play an important role in the production of sound is known as options. Option A mouth, option B larynx, option C pharynx, option D epiglottis. And the correct answer is option B, larynx. Larynx is also known as voice box. That is voice box or larynx, which play important role in the production of sound. The next question, length of pharynx in adult is about. Options, option A 6 to 8 centimeter, option B 12 to 14 centimeter, option C 20 to 25 centimeter, and option D 50 to 54 centimeter. Length of pharynx, it is about 12 to 14 centimeter. Option B is the correct answer. And the next question, the most reliable indicator of neurological function in a patient is. Options, option A level of consciousness, option B eye movements, option C vital signs, option D MRI. Which is the most appropriate indicator in neurological function is level of consciousness. We have to first check the consciousness of the patient, that is level of consciousness. The next question, visualization of maxillary sinus is known as. Options, option A ophthalmoscopy, option B anthroscopy, option C laryngoscopy, option D bronchoscopy. Visualization of maxillary sinus is known as anthroscopy. Option B is the correct answer. First option, ophthalmoscopy. Ophthalmoscopy means examination of the fundus of the eye. Option C laryngoscopy, visualization of the larynx, and bronchoscopy means radiographic examination of the tracheobronchial tree and the lungs. The next question, which is an epileptic drug? Options, option A ectomidate, option B phenytoin, option C phenergan, option D chloroquine. Epileptic drugs, it is phenytoin. Option B is the correct answer. The next question, first aid by a nurse for children during convulsions. Options, option A start oxygen therapy, option B call physician, option C put spatula in the mouth, option D restrain the child. Question, what is the first aid as a nurse we can give during the time of convulsions or fits? The important nursing actions during the time of convulsions include mainly first one, protect the child from injury or protect the persons from injury, and if it is the person or patient or children in the cot means we should immediately put the side rails. And the second thing, maintain the patent airway. We should not force to open the mouth or we should not keep anything into the mouth. Try to maintain the airway open. And the next thing, administer oxygen by mask and place the patient or keep the children in one side. This will help to drain the secretions. And the main thing, we should not restrain the child or we should not restrain the patient. Okay. Here in our option, start oxygen therapy, call physician, put spatula in the mouth, restrain the child. We should not restrain, we should not put anything in the mouth. We can give oxygen therapy first. The next question, while assessing vital signs of a patient having a recurrent attack of seizures, the nurse should. Options, option A, take an axillary temperature every 4 hours. Option B, observe for bradycardia. Option C, observe for bradypnea. Option D, all of this. What a nurse should do while taking vital signs of a patient with a recurrent attack of seizures. Among this, all options are correct. That is, take an axillary temperature every 4 hours. Okay, temperature chart should be maintained every 4 hours and also observe for bradycardia and observe for bradypnea. Bradycardia means decreased heart rate. Bradypnea means decreased respiratory rate. The next question, one image based question. Identify the image shown in the photographs. This is an Doyen's retractor. Okay, this is mainly used in pelvic surgeries. It is Doyen's retractor. Next one also on image based question. Identify the image shown in the photographs. This is an Sims uterine curette. So here we discuss some of the important questions, also previous year questions from RRB and ESIC exam question papers. Surely these questions will helpful for your studies.